Welcome everyone to the NHTSA V3 implementation call. This morning is May 13th. We appreciate you being here with us. As always, if you haven't updated your name in the participation box, please feel free to do so, especially if you're a vendor, so that we can make sure we add your participation to our tracking list. We'll go ahead and move down to the agenda. Okay. We've got lots of topics on for this morning, but I think it'll go pretty quickly. Feel free, though, to participate during the conversations or save your questions till the end at open forum. You're welcome to bring up any questions or issues at that time as well. We'll go ahead and start things off with Chris Hoffman. He's got an exciting announcement for us. Do you want the screen, Chris? We'll just turn it right over to you.
Absolutely. Actually, you know what? We can leave it right here for now. I just wanted to let everybody know. Good morning. First of all, thank you once again for joining us today. Did want to announce that the 2019 NHTSA Public Release Research Dataset is been released. Yay! And is ready for public consumption. So the research data set includes 34,203,087 EMS activations, which were submitted by 10,062 EMS agencies, which serve 47 states and territories during the 2019 calendar year. Just to let you know, the data set does not contain information that identifies patients, EMS agencies, receiving hospitals, or reporting states. And the EMS events submitted by the states to NHTSA do not necessarily represent all the EMS events occurring within a state. In addition, states may vary in criteria used to determine the types of EMS events submitted to the NHTSA dataset. If interested parties are welcome to go to our website and request a thumb drive which contains the 2019 NHTSA Public Release Research Dataset, and that a encrypted thumb drive will be delivered lovingly to your door by the United States Postal Service, and it is shipped out by the wonderful Bridget. So if there are questions, concerns, or comments about the public research dataset, I'd be happy to take them at this time. Perfect. As always, if there are questions that come up, please let any of us know, and we will get your question answered as quickly as possible. Cool. Thank you very much, Julianne.
Thanks, Chris. Appreciate that. Next, we've got Laurel on the 3-4 data dictionary.
Morning, everyone. So I just have a quick announcement for an update to our 3-4 data dictionary. So we have been planning for a long time to do a little bit of an update to include the schematron rules, much like we've done for 3-5. So we're looking at doing that in the near future. Our update will also correct some broken links throughout the data dictionary, as well as some other small inaccuracies and misspellings in the descriptions and comment sections for elements. This will necessitate a change to the 340 XSDs, and we will have a new build number released, but there will be no element changes, so it shouldn't affect anyone's use of the standard. All of the elements will work in the same ways with the same value choices. There will just be less misspellings in the dictionary. Does anyone have any questions about this change? Great. Well, if anything comes up, feel free to bring it up in this meeting or send us an email, and we'll address those as quickly as we can. Thank you.
Thank you, Laurel. Appreciate that. Next on the agenda is custom values for alternate care site. I'm going to show you where you can find custom values on our website. So if you go to the main NHTSA website, technical resources, come down to the National Custom Element Library. Custom Element Library is right here. If you haven't loaded this library recently, sometimes it'll take a few minutes for everything to populate. So just be patient for all the colored states to populate and also for the National Custom Elements to populate. But then you can click on National Custom Elements. If you notice in D Facility 01, alternate care site has been added here. Alternate care site has also been added in e-disposition 21 under type of destination. So alternate care site is also there. And we went with the term alternate care site based on the conversation from our last V3 implementation call. So we really appreciate your willingness to contribute to those conversations. It's very helpful. You can also find just an info sheet on the National Custom Elements that have been adjusted for infectious disease. So on our front page, it's the third tab on the scrolling banner. That'll bring you to just a PDF of the National Custom Elements that have been added for infectious disease, additional values, some ICD-10 codes, and other reference material. So that is available to you to use as you need to, and we're happy to send that PDF to you as well if you need it. Any questions on alternate care site for custom value? Awesome. So next on the agenda was tracking of the National Schematron version for each state. This was a request from a stakeholder, and we just wanted to show you where you can find that information on the website. If you go to the NHTSA main page, State Data Managers, and then right here for the state map, for the V3 state map, go below the map, and you're going to see just a simple spreadsheet with the National Schematron version for each state and territory, what version they are on, and when it was updated. So this refers to the National Schematron version, not the state Schematron version. State Schematron versions are all that information is listed in the individual state sites. So that's available for your reference reference as well. Any questions on either of those issues? Excellent. All right, Clay, you've got the discussion next with RxNORM and SNOMED.
All right, thank you, Julianne. Appreciate the opportunity to be with everyone this morning. Juan in Florida, I'm going to ask you in just a moment if you might be willing to share the post that you shared with us last week. Been an issue brought up that may provide an opportunity for us to discuss an approach that kind of ensures some consistency across the country. It relates to how often vendors are updating their RxNORM and SNOMED codes. Juan, would you be willing to share why this became an issue for the state of Florida?
Yes, we were looking at the compass measures, which are now NHTSA, and we were looking at the results of those measures, and a lot of the agencies were saying, no, we are reporting that information. So we looked at the information that the agencies were reporting, and we were looking at the codes that NHTSA provided. A lot of the RxNORM codes, specifically for hypoglycemia, have been updated, and the agencies are still submitting the old RxNORM codes for the medicines that they were giving. So their values show that they were not giving the appropriate medications for hypoglycemia. So we're wondering how long it takes an agent, how often the vendors are updating the RxNORM codes based on what's been deprecated and deleted and now considered obsolete, and the new codes that are being provided by RxNORM.
This is Josh Legler. in my work at the state level, I check those codes in the demographic data submitted by the agencies and work with them at that stage to correct any codes that need to be corrected. I do see agencies that submit codes that have been retired from RxNORM, and then I help them to switch over to the codes that are currently on the state list or the NHTSA suggested list for those particular medications. So that's one approach that helps you to catch things up front rather than, you know, a year later when you're trying to look at some PCR data and find some holes.
Yeah, so maybe two issues here. One relates to kind of the foundational question, that is how often are agencies updating their code sets? Clearly ICD-10, RxNORM, SNOMED, CT, all of those have a schedule whereby they either deprecate or add codes. We looked into this recently and are trying to improve our measures here at the national level for ensuring that those code sets are up to date for the reporting that we do. But I don't know that there's kind of any standard that we've applied or asked the vendors to adhere to. That's probably the important question to just discuss here briefly. Then the other question, of course, is that NHTSA has updated the inclusion criteria, the stratification criteria that's associated with the quote compass measures that have now been modified, and it would be interesting to see how many states and vendors have utilized those recent updates. But let's get to the earlier question. Josh, can you provide the listeners, just based on the recent investigation that you did, how often does RxNORM, SNOMED CT, ICD-10-CM, how often do they update their lists of codes?
Yes, ICD-10 is typically updated annually in the summer. And occasionally they'll do an interim update like we saw with COVID-19. That's only happened every, I don't know, decade or so. So usually that's once a year in the summer for ICD-10. SNOMED is, if I remember right, twice a year. Might be once a year. I think maybe it's once a year. It comes out at the international level in January, and then there's the US set of SNOMED, which comes out in March. So in March of each year, we get the SNOMED updates. And then RxNORM is updated weekly. They have a weekly incremental update, and then they put out monthly full sets. So you could either grab the stuff that's coming out weekly and process it as an incremental, or you could grab the monthlies as a full set to process.
And of course, maybe important to just add to this conversation is even if you include interfacility transfers in the data that's collected at the state level or the vendors collect, we clearly don't utilize the bulk of ICD-10-CM, and the same would be true for RxNORM or SNOMED CT. So a lot of the updates or deprecations would not be important to us, but clearly there's real value in keeping those data sets up to date. I guess I'd just be interested in hearing from vendors.
Hey, this is Chris Haas. I'm having trouble hearing you. I don't know if everybody else is, but you're a little bit muffled.
Oh yeah, sorry about that, Chris. Are others having difficulty hearing me?
Sounds like you're in a fishbowl.
Oh, I apologize. Well, I'm not sure how I could quickly change that. I'll open it up to the vendors for those who may want to voice some opinion about how we might keep those codes up to date, and I'll work on improving the audio. Do vendors have some comments regarding the updates of these code sets? Is my voice any better now?
Yes.
Okay. So not hearing any comments from the vendors on the phone. If we were to request by a certain date every year, just based on what Josh shared with us, I think if we could work to communicate and to organize a joint 1-year update of these code sets that are vital to the use of NEMSIS, would vendors be okay with that kind of an approach? And what could NEMSIS provide that would be helpful in regards to allowing them to update the codes that are important to EMS? Is there something that we could provide?
This is Craig from Safety Pad. My only concern is, like with us trying to manage our code updates, the lists are pretty large, especially from like RxNORM where there's over 2 million codes. Would you guys be willing to manage that for us? I mean, not manage it for us, but manage a list that would be usable to us.
Well, I'm sure RxNORM publishes their change logs, so maybe it would be as simple as collecting those. But I'd agree if since NEMSIS wants to use the RxNORM, then if you could gather those together instead of having to look through the weekly releases, that'd be a big help for us.
Thanks, David. Other vendors? Other thoughts? So Josh,
yes,
have
hi,
you put? Yeah.
this is Elizabeth. Of course, with ICD-10, October 1st is the date, but it got updated on April 1st. But NEMSIS doesn't even accept the code. So the new codes that were created are not even accepted by NEMSIS.
Right. Some of the code sets, yeah, for example, Elizabeth, are you speaking specifically to the U code in ICD-10-CM that the CDC recommended being used for COVID? Is that what you're referring to?
Yes, and vaping,
yeah.
And it's going to be used much more.
Right. So that's a perfect example of where in hindsight, several of the patterns that we try to limit the number of codes that are possible just for data integrity. But clearly, we should have included a set of U codes in ICD-10-CM that would be related to infectious disease outbreaks, and so that's a change that we do need to make. Thank you, Elizabeth.
Yeah, and to your credit, the U codes are completely new. They didn't exist before, so that's why, excuse me, they weren't in the pattern.
Yeah. Josh, have you put any thought into the idea of updating code sets that are somewhat specific to NEMSIS, maybe limited to patterns, and then in a way that perhaps could be made available to vendors? We've done this in the past with version 2. We set up a process with UMLS where we maintained data code sets that vendors were able to access. Have you put any thought into that at all, Josh? I know we're just at the preliminary stages of this.
Yeah, for everyone's information, over the next several months, the NEMSIS TAC is going to be addressing its own use of these external standards in the data warehouse, and that manifests itself through things like the Cube interface and the dashboards that NEMSIS publishes. So the plans are being put together for NEMSIS to stay synchronized with these updates. I just double checked, SNOMED is updated twice a year, March and September. So the plan is for NEMSIS to do its updates, just following the cadence of each external standard. So ICD-10 would be annual, SNOMED semi-annual, and RxNORM monthly. And the plan at the NEMSIS TAC level is to process all of the codes that would be valid So it'll be a full processing of ICD-10, of SNOMED, and of RxNORM. We do tend to prefer certain codes. For example, in RxNORM, it's preferred to use ingredient codes or multiple ingredient codes. However, it is valid to use other codes as well, including brand names or clinical drug packs. And so it probably is necessary for the software products to support all of those potential codes, even if some of them are rarely used. NEMSIS does put out suggested lists, so those are available, but the question here really is about, hey, you've got an agency, a customer who has some medication that they carry that's not on the NEMSIS suggested list because they have something unique about their operation, and they need to be able to use that code that is in fact in RxNORM. So it probably wouldn't be much of a leap for NEMSIS to provide each of those lists in a form, some standard format that everyone could utilize. For SNOMED and RxNORM, those would need to be put behind a UMLS authentication step so that that license requirement can be met. For ICD-10, I think they could be provided publicly. So that would save some time for the vendors, because the NEMSIS TAC is planning on doing a bit of processing on these lists in order to do things like implementing the hierarchies in ICD-10. And in RxNORM, we're going to be implementing the relationships so if someone uses a code that's not an ingredient code, we will be able to map back to what the ingredient code would be, so that we can get some more consistent analysis out of the data. So some of that work being done by the NEMSIS TAC then would be probably useful to vendors, and it would save you some time doing that. And also, if we provided it in a consistent format, I think that'd be helpful, because each of these sources has a different format for their data that it starts in. So there's a few thoughts anyway. Yeah, I think it probably could be helpful. There's still going to be large lists, and you just need to have those in your database and have them indexed and available if someone needs them, that they have a way to pick them.
Any comments related to the ideas that were shared by Josh?
Hey, Clay.
Hi, Keenan.
I think I have some concern when we talk about the regular update sort of outside of the yearly sort of change that is put forth. Mostly in the fact that we do maintain these databases, and we allow our customers to sort of update their database sort of when they're ready and as they see fit. And as we deprecate and add different items, there's also sort of a reconciliation that must happen on each individual organizational level when it comes to this has now replaced this, or this supersedes this that we have not accounted for. And quite frankly, we don't have, if this came down from NEMSIS, I don't know if we have sort of vetted out the proper way to do this on a super frequent cadence. I also sort of question if you guys at the TAC are working on sort of getting a process together to update and sort of reconcile these codes. Would it be helpful for you to sort of go through that process and then let us know what you learned, and we could then discuss following suit?
Yeah, Keenan, good thought. I think we would expect that, that we, of course, here are trying to improve our process, and then also provide some standardized tools that may be valuable for vendors. We'll do our best to keep you involved in what those structures may look like, what we're thinking of doing in regards to providing a process. And then, yeah, of course, Keenan, it will be valuable for you to be in the loop to determine if it's a process that you can take advantage of, and reduce some of the resources that you're putting forth, just to make sure that those type of changes are up to date. So thanks, Keenan. Yeah, it's important to remember.
Also, I'd like to just point out that many vendors on this call and not also have, revenue cycle management and billing software that they sort of overlap a lot of these data sets with, that makes it more complex than just switching out a code.
Yeah, thank you.
Yeah, and I'll mention, one of the pieces to the approach that we'll use at the national level for updating these lists is that whenever a code is retired or deprecated, we will continue to recognize it, and it will continue to exist in the NEMSIS data warehouse. It'll just be marked as deprecated or inactive. So if agencies continue to use that code, we will continue to know what that code meant. And so it's a matter of, NEMSIS TAC being constantly up to date in terms of what the codes are. And then that enables feedback to say, hey, this code, a few months ago or 2 years ago or whatever, it was deprecated. And it may take time for agencies to go ahead and swap out that code with a new code and make sure their billing process still works and everything. But at least we get the right information as a foundation. So yeah, we'll never be deleting codes from the tables. It'll always be just marking them inactive so they can be flagged that way. I guess I'll also mention from the compliance testing perspective, each year's compliance test cases, which are now going to be updated annually, each of those test case sets contain at least one code from each of these data sets that was added within the last year. So if you do go through compliance testing and you have not updated your software at least within the past year, then you'll run into some issues there in compliance testing.
Yeah, also thank you for the comments from James, Matthew, and Hans on the group chat. We snapshot those chats and we use those comments as we make decisions based on these calls. So thank you. Feel free to post. Any other questions regarding the ability to keep these code sets updated? Any other advice you'd like to offer us as we begin to work through this process here at the NEMSIS TAC? Okay, great. The other question related to this has to do with the update that's been made to the EMS compass measures that are now maintained by NEMSQA. Maybe we'll hold this question for a follow-up call. We've done a fair amount of work with NEMSQA in, I don't know, the last 6 months. That effort was led by Josh and the IT team here at NEMSIS TAC as we attempted to incorporate their new algorithms. We found some issues and reported those back to NEMSQA, and they've made appropriate changes. I don't know that those updates were publicized well, and so perhaps it might be valuable to just review those a little bit and make sure that all the vendors understand that there are new algorithms. So just to ensure that agencies using different software may be viewing the same metrics calculated in the same way, that might be valuable to do. So maybe we'll hold that to a later call. All right, I'm going to move on to the next item just to keep us moving. This is an important item for everyone in regards to the annual NEMSIS V3 implementation meeting that's held in Deer Valley, Utah every year. We of course are disheartened to report that we're probably not going to be able to hold the annual face-to-face meeting in August as was planned. Both state regulations here in Utah in regards to the COVID-19 response, and then also with feedback from the Office of EMS at NHTSA, we've been advised to cancel that meeting, that face-to-face meeting. So with that being said, our plan moving forward, they're attributes of that meeting. They're important to vendors and to states for a number of reasons. Let's talk about each of those just with our plans moving forward. We're thinking of planning 3 different Zoom conference calls, 4-hour conference calls for different audiences and different purposes this summer that would take the place of that face-to-face meeting in August. So there would be a meeting associated with the software vendors that if they participated in that 4-hour training, then they would meet the requirements of attendance for compliance tracking. The 3 separate Zoom 4-hour meetings we're planning to put together. One would be a base camp, a 4-hour base camp for new state EMS data managers that want to learn some of the basics associated with NHTSA, or for existing state data managers that want a refresher on some topics related to NHTSA. It was well received last year. We held it on Sunday before the formal meeting, and folks would like to see that happen again. So there will be a 4-hour Zoom training that is basically a NHTSA 101 base camp. Then that meeting would be separated by at least a week or so, and we would offer another Zoom conference specific to software developers, where we would meet for 4 hours, talk about the topics that were going to be covered in the face-to-face meeting that are important, our work with ET3, their plans for the development of a CMS enclave for the receival of data for agencies participating in ET3. Lots of stuff going on right now in the Office of EMS at NHTSA regarding how we're going to spend the next few months, potentially between outbreaks of COVID. If we do in fact see a reduction for summer or for fall, there are some things I think that NHTSA would like us to deeply consider in regards to reporting. So there will be lots of good information in that meeting. And then following a week or 2 hiatus, we'd have a 3rd meeting specific to state data managers, another 4-hour meeting where we're covering just as important topics that are timely and important. So that's our plan for how we would handle this year's annual meeting rather than a face-to-face in Deer Valley in August. So with that being our plan, and we're working on the development of those 3 Zoom meetings now, are there any comments from states or agencies in regards to that plan?
Are you going to get the opportunity to have your cross-talk between your vendors and states still?
Yeah, that would be perhaps the one segment of our face-to-face meeting that is incredibly valuable, other than the fact that we all sit in the room and we're sharing ideas very quickly. We'll lose a part of that. This plan does kind of remove that possibility for vendors to talk with states about issues that are important. I'm not sure quite how to handle that, David. We could clearly combine, the vendors and the states onto one call. There'd be upwards of 70 people on the call. That may be difficult to manage. We've talked about maybe there's clearly rooms that you can utilize within Zoom. Maybe we would break the team or the audience off into different rooms to discuss different issues. That's a possibility. Do the vendors and states feel passionate about that idea of still being able to exchange comments related to the issues important to both of those groups on the same topics? Should we try to ensure those groups are together? Yes, sorry.
Hi, Clay. This is Samantha with ESO, and I would say that was one of the big highlights of the NHTSA TAC annual meetings. And I think if we could have focused discussion sessions, maybe an hour here and an hour there, kind of like a work group, but for the vendor and the state data managers, that could be a nice replacement.
Yeah, thank you, Samantha. Someone else was going to speak. I apologize. I cut them off.
Hey, Clay. This was our soapbox last year. It will continue to be our soapbox this year. If we wanted to just talk to ESO and MSGen and the rest of the people, the rest of the vendors, we would just call them and talk to them. The value of the state meeting is to get in a room with the states, and the TAC hasn't changed. We're going to always advocate for that.
Yeah, thanks, Keenan. Other vendors or states have opinions?
There's a handful of yeses in the chat. So some people would find having the states and the vendors in the same room valuable.
Thank you, Tim. All right, great. I'm seeing a lot of affirmation from both states and from vendors from bringing both of those two groups together. We'll work to make that happen and potentially put together an agenda that would take a good use of the work group or rooms that are available in Zoom, and see if we can come up with something that would be as effective as possible. So yeah, thank you for that feedback. That changes our thinking a little bit, and we can certainly work in that direction to have an ability for the entire group to be together with some organization. Thank you. All right, any other questions regarding the format of the annual meeting this year? All right, thank you, Julianne. I'll turn it back over to you.
Thank you, Clay. Next up is Kevin on the ILI dashboard.
Thank you, Julianne. First, I just want to thank everyone once again for being open with us about what their data is in terms of this pandemic. It's been incredibly helpful and valuable to us. The dashboard, the ILI dashboard, is now being used daily by FEMA and the White House to track the impact of COVID-19 on pre-hospital resources, and we really couldn't have made that happen without your input and cooperation. In addition to that, we're seeing steady traffic to the dashboard from both state and federal officials, which is just fantastic to see. We've also received lots of valuable feedback to date, which has really helped us tune the dashboard to everyone's needs. And we always love to get feedback on anything that we produce. So if you do have feedback or something that you're just wondering if be valuable maybe just for you, please let us know. We do our best to evaluate that feedback and incorporate it where we think it's going to be of value. In addition, we've received lots of requests for information on the impact of this pandemic using NEMSIS data, which has been also just amazing, not just utilizing the dashboards, but also our cube, which has been really great to hear that people are investigating other aspects of what's going on in the nation today. And finally, if you have any questions, again, if you have any feedback or would like to know how to get your state included in that dashboard, please do not hesitate to contact us. Any questions for us right now on that dashboard or anything related to our ILI data? All right.
Yeah, Kevin, this is Clay. Maybe just one quick comment I would share. As folks probably know, the definition defining influenza-like illness for inclusion in dashboards, either at NEMSIS or the CDC, all of those vary somewhat. And we've tried our best to marry the definition that we're using with other sources like the CDC or HHS The problem is those just don't jive well because the process of assigning codes in the pre-hospital setting is just by the very nature different than the way a hospital may code symptoms or conditions. So we continue to try to provide the best definition for the pre-hospital setting possible. What ends up happening is the rate of ILI that we report can be different and look different from rates in other visualizations. I'll mention that Josh Legler and the team out of the EMS authority in the state of Oregon identified a way for us to potentially improve our definition. It will make the rate of ILI increase in the daily reports that we put out to the federal government and to the states. And so if you receive comments regarding that, we'd be happy to talk to you about how we've changed that inclusionary criteria. Again, this is a learning experience, I think, for all of us, and the best way to measure things like ILI, perhaps during this hiatus in the infection, if that occurs. I know the Office of EMS is talking about trying to determine some more standardized national definitions for things like that. So that's my only comment there.
Clay or Kevin, would one of you take just a second to clarify really quick who has access to the ILI surveillance dashboard?
Yeah, I can take that, Julianne. So if you are a state data manager or have been authorized to see your state's data in any of our dashboards, you have access to this dashboard. And in addition to that, we have granted limited access to a select number of federal officials. That list has been provided to us through the Office of EMS at NHTSA, and we've implemented that. So it's definitely not a dashboard that just anyone can access. We always keep the security of our data and at top of mind whenever we go through this process. So state officials, authorized state officials, and a select group of federal officials as well. If you think you're supposed to have access, but find out that you don't, again, please contact us, and we will we'll make every effort to help you with that. Thank you, Julianne.
Thanks, Kevin. Thanks, Clay. Any questions on the ILI dashboard? All right. I just wanted to spend just a second talking about the tracking for participation in for our vendors. So if you go to the main website, let me get all this other stuff out of my way. You can go over to technical resources, compliant software status. And on this page, you can see the list that we keep the tracking for the software companies, whether they are receive and process, or if they are collect data. So name of the company, product name, V3 participation call, and then annual meeting participation, which we've started the discussion on how that will be adjusted as far as facilitating that this year. But this is where we keep track publicly of the V3 call participation. So we appreciate when you log into the call and give us your information so that we can make sure we're tracking this appropriately. There are still a few products that have not participated in the V3 implementation calls. And if you're a state that uses one of these products, we would be happy to receive any contact information. We haven't been successful in contacting some of these companies. So if you work with a EMS software vendor that you would like us to reach out to, please just let us know, and we're happy to help with that. And then the final item, not the final item, almost the final item, items from the Office of EMS, NHTSA. Eric, if you had anything that you wanted to bring up and discuss, we would love to hear from you.
Hi, good afternoon, everyone. So just a couple things. One is thank you for everyone who's been providing data as we've requested it. It's been very helpful to report out actual numbers at the NRCC level. It's been a challenge educating people on what the capabilities are and what we have available in terms of data for the national picture of what's going on with COVID-19. But I think we're starting to win them over now. It's starting to be used on a more frequent basis. So I do want to say you're probably going to see additional requests for this. We just had a call earlier where we were discussing the sort of tail of what they're calling this wave, and then the wave, the potential next wave, and what we're going to do in the interim. So you're going to hear a lot more about what some additional requests and capabilities will be as we look towards the fall. One of the other things I just wanted to mention, it's not a particularly a version 3 topic, but it's one out of NHTSA that will affect probably everybody at some point. We have put in for this year out of the, let me back up, the 29 January Data Summit that we held in Washington, D.C., where many of you participated. We talked about a lot of different things that needed to be done. One of the priorities was this bidirectional data exchange with hospitals. And we at NHTSA looked at that as a high priority topic. It was a high request out of that meeting, and we have funded that. So you're going to hear a lot more about gathering what current vendors are doing in terms of hospital data exchange and looking forward at how we should approach that at a national level. I just wanted to give you a heads up. We haven't started the project. It was just funded. But I wanted to let you know that we were listening to what was said in January, although that seems like an eternity ago. And it's not been on the radar for the last couple months for certain. It is something that we moved forward out of that meeting. With that, I'd be happy to answer any questions for NHTSA, for DOT, and beg of you, if you have things that you think would be excellent dashboard topics or things that we could report out at the national level, success stories at the state you would like to share with us for consideration at a national level, I would love to see them. Just shoot me an email and I'll get right back with you.
Any questions for Eric? Okay. Let's go ahead. Thank you, Eric. Let's go ahead and move to open forum. If anyone has questions or concerns that they would like to bring up, we're happy to discuss those.
Hey, Julianne, this is Juan.
Hi, Juan.
I was going to ask about the national custom elements. We're going to adopt the national custom elements. Do vendors want us to add those elements to our dataset builder, or can we just use a national dataset builder file, XML file?
That is a great question, and I'm not the best one to answer that. So let's.
This is Josh. My opinion
Josh.
would be
Josh,
that you
yes.
that you add it to your state data set, because that's how you communicate to your agencies and vendors that that's an element that you'll be collecting. Also, your configuration could differ slightly from the national one. For example, you might make it a required element, whereas nationally it was tagged as optional. Obviously, it's great to follow the same definition and codes and everything so that they can be implemented consistently. Then the other benefit is when people go to the custom element library, they will see that a particular element is not only a national custom element, but it's one that was adopted by Florida as well.
Okay. And then that
If
leaves,
there's any vendors who have a different opinion, we'd love to hear it, but.
okay.
Just want to point out that some of the states that do have the existing elements, if those could be removed from their data sets, that could help avoid confusion.
Did you mean like states that have a custom element that is similar to the national custom element and
Right,
recommending
similar,
that they
yeah.
migrate to that standard
Right, right.
approach? Okay.
Then the other question would be, if there are two custom elements, we have a custom element that we defined to extend one of them, and then the national also extends it. How do the vendors handle that? Because they're having trouble with two custom elements that extend the same element.
So you're saying you have, for example, a custom element in Florida that extends some NHTSA standard element.
Yes.
And it happens to have some different codes and things compared to a national custom element that was published, or for sake of argument, another state's custom element that extends that same NHTSA element, right?
Right.
Yeah, okay. Yeah, so vendors would need to support that. They need to be able to provide what Florida requires in Florida and what Massachusetts requires in Massachusetts.
And I think that's easier, but now that their NHTSA has custom elements, their definition is different than what we have. So they have to implement two versions for the same state.
Yeah, and the national custom elements represent a reference, really. And so if a state does not require that or even collect that custom element, that element doesn't necessarily need to be implemented in that state unless a local agency says, well, yeah, we really want that element. We want to collect it locally. So the national elements serve as a reference, and the actual implementations happen when a state or a local agency says, we want to collect this custom element.
And I mean, that is the fact that is happening. So we don't know. So some of the vendors are asking how to handle that.
Mm-hmm.
Yeah, I think our
Go
one's
ahead.
perspective, probably the best way to handle this would be that if a state wants to adopt a national custom element for an element they've already extended, that they do that inside of their already extended element. Does that seem reasonable to everyone?
Right. For example, in Oregon, they have extended the PPE used element, and it does include the codes that are on the national custom element for PPE used. But they have some additional codes used in Oregon that are not in the national custom element. Oregon provides one custom element configuration that extends that element that contains the complete list of codes that Oregon recognizes.
Yeah, this is Clay. Probably the slightly more problematic example that Juan is offering is, for example, destinations, right, where we've added the CMS approved alternate care destination. I know some states are providing more specificity than that, and it is a nationally reported element. I would imagine that those just all get rolled up. I guess the only recommendation would be to have states roll those elements up using the same algorithm that we define in the national element, just to assure that we're rolling up for a standard element at the national level. Does that make sense?
Right, and in implementations that I've seen, typically the vendors have, for an element that extends a coded list, like type of destination, vendors have just provided all of the different codes that different jurisdictions have defined, and the agency turns on the ones that it needs, either because its state requires it or because it has a local need, and it just leaves the other ones turned off if it doesn't need them. Any other vendors with perspectives on if it's been challenging for you to implement a custom element that extends an existing NEMSIS element where different states have different codes than what the national custom element uses?
Juan, was that helpful to your question?
Yes, like I said, I just wanted to get the conversation started and see what, see if people had other suggestions.
Okay, good. Well, we appreciate that. Because if you're thinking it, somebody else is thinking it as well. Any other questions or comments?
I had a question
Topics
about
for discussion?
ICD-10.
Yes, please. I'm sorry. I saw your hand up and I was trying to remember and it's PSOC?
Yes.
Okay. Yes, please.
So I'm talking about new ICD-10 codes. Can you hear me well, by the way?
You're a little muffled, but you're getting through.
All right, thank you. So talking about the new ICD-10 codes, I was trying to understand the process for updating the pattern to the eSituation.11 field. So there are some codes that we'd like to use that don't fit that pattern, but they're the best codes that we could think of for the situations they apply to. And our vendor basically said, well, it doesn't fit the pattern, you should reach out to the state. The state's looking at the NEMSIS pattern, obviously. And I was wondering what the best process for that is.
Let's see,
Yeah,
Josh,
this is
you're
Clyde.
fine. Okay.
I'm happy to take that. It's a really good point. I think we've learned some important lessons associated with the COVID pandemic regarding maybe some areas where the pattern doesn't allow for some elements that are important to include. So I know that Eric at the Office of EMS has talked to us about this and what we potentially need to do in 3.4 and make sure is included in 3.5. So that's a topic that we are actively discussing, and I imagine some movement will be made on that probably this summer. So I know it's not helpful for the immediate future, but we should have some changes to the standard soon.
Yeah, just to clarify, I'm not referring to COVID-related codes. Is that for in general?
Well, and if you want to send us the list of codes that you're thinking of including, and we can take a look at those. I know some of the sections associated with ICD-10 we have not seen good reasons to include in the pattern, and if they're included, people will make use of them, and there are codes that have to do with intricate surgeries, for example, that we're just not able to use. So having those codes open just decreases data integrity. So we try to maintain a pattern. Be happy to take a look at the codes that you've been thinking of adding and ensuring that we evaluate them as to whether open up that part of the ICD-10 code set.
That's great. I appreciate that. What would be the best method or place to send those to?
Probably to Julianne or I. Both of our emails are available on the website under staff.
And I just sent you a message in chat. So if you open your chat, you'll have my email, and we'll be sure and discuss those internally.
Excellent. I appreciate it. Thank you.
Thank you.
This is Elizabeth. I have two questions. First of all, 334 sunset is still scheduled for, I believe, February of next year, whereas 3.5 acceptance has been postponed. So the states that are currently on 334 will need to be off and possibly need to go to 3.4 before they can go to 3.5. There's this gap there. Is it possible that 334 can be extended too to match the postponement of 3.5?
So Julianne, can you bring up the schedule on your screen? So
And,
yeah,
and
we
my
did.
other, yeah. And my other question is, I presume that everything that we're putting in for 3.4 in the custom elements is going to be included in the regular 3.5 release. When are you planning on releasing an updated 3.5 set? As we're all working to get 3.5 in.
Right, Elizabeth. So great questions. So I'll answer your second one first. There's not complete clarity that each of the custom elements that have been provided nationally will be implemented as new elements or values, value extensions to elements currently, simply because, for example, some of the types of destinations are currently just made available under the Public Health Emergency Proclamation as temporary. So we're not exactly sure yet what will be required or for CMS in the future, and what other attributes we've added as custom elements will be really essential if we ever handle another outbreak. So I'm not sure that everything will move over to 3.5, and I think it'll be some time before those decisions are made. So we can try to keep you abreast of that. But I think it's pretty clear to say, Elizabeth, that we don't see a change to 3.5 immediately regarding the custom elements or values that are out. Then in regard to your question about, we have moved out the green flags, I hear that are listed just by 6 months. These are not hard dates. They were just kind of estimated dates that provided some clarity for states and for agencies and for vendors as to when we'd like to have the 3.5 products basically available in the marketplace. Those have moved out by 6 months. So I'm not sure, Elizabeth, that vendors that are doing only 3.3.4 will even try to move to 3.4 before they move to 3.5. I'm hoping that
it's more to states. States that are on 3.3.4. You know, it does not make sense for them to go to 3.4 and then to 3.5. But if the general broad market availability has been postponed, then it doesn't match up with the killing of 3.3.4.
Yeah, I see what you're saying. So, again, the green flags really aren't hard stops. So, yeah, would we extend 3.3.4 out? I don't think so immediately, Elizabeth. We could think through that. I mean, the same issue was present even when those green flags were moved in the opposite direction 6 months. They were clearly still just, they're not hard stop dates in any way.
Hey, Clay.
Yeah, Keenan.
I think what we're sort of suggesting is maybe some dialogue with the states that are taking and how this would affect them, right? If we say that the majority of vendors will not be ready to submit 3.5 data until August 2021, then what are the implications if you are a 3.3.4 state that maybe was going to go to 3.5 directly from 3.3.4 versus making a step in between the two, right? So what that would put you in a position of you collecting 3.3.4 data early 2021, not being able to collect 3.5 data and sort of having that six or more months of just sort of floating where you're getting useless data.
I see what you're saying, Elizabeth and Keenan. Thank you, Keenan. That clarified it for me. Okay. There are a handful of states, you're right, that are still collecting 334 data, and we know what states there are. We'll talk to those states. Thank you for that clarification. Sorry. Sorry, Elizabeth, I wasn't immediately understanding your question. Thank you. Okay. Yeah, thank you.
And this is Josh, just on the other comment of the national custom elements. The national custom elements are currently being provided in version 3.4.0 format in that state data set format. And so we will need to make a decision sometime before 3.5 software becomes widely available in the industry to provide those same national custom elements in the 3.5.0 format, or a decision to roll some of them into a release of the 3.5.0 standard. I know we've gotten lots of feedback over the years about updating the standard tends to push implementations further down the road. So anyway, that we will need to have that discussion sometime, in the coming months.
And I'm going to say it one more time and then forever hold it. 3.5, the e-situation 11 and 12 at least need to have the pattern updated to include the U codes. That alone deserves a release.
Yeah, thanks, Elizabeth.
The earlier we get these changes, the less it's going to delay us in implementing them.
Yeah, thanks, Keenan. Appreciate it.
Are there any other questions or comments?
It's Frank with R1. We definitely support the versioning of the National Custom Elements Library. That's what Josh was talking about. All for that.
Do you mean you support rolling those into the 3.5.0 standard, or just that NHTSA put out and publish a 3.5 version of the custom elements in addition to 3.4?
Right. Yeah, the latter. If they roll into the standard, great. But if not, then if there are any implementation differences between the versions, that be clear in the elements as they publish.
Yeah, there's two main differences that I can think of. One is that there is a national custom element in 3.4 that is already a standard code in 3.5, so it's not necessary in 3.5. And the second is just the format and structure of state data set changed in 3.5. The elements have different names. It's a direct translation from 3.4 to 3.5, so it's not a big deal for us to put out a file in 3.5 format, but it's just technically speaking, it's a different file.
Right. Yeah, the one that's included in the standard is the one that drew our attention to it. But I think as time goes on, those complexities might get more complicated.
Right. Yeah. So it's definitely clearer for you if you can grab the custom element definitions in a specific version.
Yes. Thank you.
Great questions and discussion. Is there anything additional? Okay. Our next meeting is May 27th. These meetings do occur on the second and fourth Wednesday of every month. So like last month, we ended up with an extra week. So we had several emails last week on when the call was going to occur. So just as a matter of reminding, they occur the second and fourth Wednesdays of every month. So the next one is May 27th, same time, same place. If there are issues that you would like to be on the agenda for discussion, please feel free to send those to us, and we're happy to investigate and include those for discussion. We really appreciate your contribution, your willingness to have these conversations and to facilitate the best data collection that we can. Thank you all for your time this morning. We appreciate it, and have a fabulous day. Thank you.
Thank you, everyone.